facility for flow cytometry, facility for tissue typing. This all we are offering to the patients, and we are getting patients from all over the country and outside globe and performing wonderfully well in this area. So whether it is magnetic separation of cells, cryopreservation of stem cells, HLA typing, flow cytometry, minimal residual disease detection, everything is done in-house in our hospitals. After bone marrow transplant, the second important area where we are very active in cancer care, where we get patients from all over the globe, is on the surgical oncology. And there again, for cancer care, we have specialized doctors who are doing cancer treatment only for head and neck, special training and special trained doctors who are treating only breast patients, breast cancer patients, who are doing only bowel, or who are doing only tumors of bones. Like this specialization is there after the super specialization or MCH in surgical oncology. So a fourth level of specialization has come in now, and we are functioning as per that protocol in our hospital. Radiation oncology again is something where you treat the cancer with radiation, and here again the role of technology is paramount. So we have the latest IGRT, IMRT, VMAT facility in our hospital, and Dharamshila is always the first one to bring the latest technology. This technology, along with we have the great infrastructure, just like a 5-star ambience in the hospital, with the latest facilities, ROs, CSSDs, firefighting, and facilities like what I am showing in this slide, the platinum room facilities, where international patients, and these facilities are offered at a very, very subsidized rates. Means what big corporate hospitals will be charging, we are 20 to 25% lesser, and care level is very, very high. ICU, this is again a world-class ICU model which we are following. Lot of daylight comes, and bed-to-bed space is very high. So good bed-to-bed space prevents the chances of infection for the patients. All categories of beds are there. This is the cross-subsidy which I was mentioning. The people stay in general wards who are not able to afford much. Then depending on their pockets, it can be semi-deluxe, it can be deluxe room, it can be a platinum ward, but we treat all patients like equal. We have a very great team of consultants, and each one of my team members in the consultants are super specialists in their area and have more than 5 years of experience of working with good, big, renowned names. Along with doctors, of course, the role of nursing especially is very high when it comes to cancer care. We have a dedicated nursing council recognized program which is known as PBDON. So we create specialized nurses in oncology. And this Dharamshila is one or two, only 2 centers in the country which are producing surgical oncology nurses. Teaching and training is one of the forte of our hospital. We have a running DNB program in medical oncology. We were the first one to start DNB program in the country in oncology. So Dharamshila has started this, and we have right now the DNB programs running in medical oncology, surgical, and radiation, along with pathology. Intensifying training, this is one area. We have seen that in last 1 year or 1.5 years, we have stressed a lot on soft skill training. And this has given us a lot of results. And I put a very special word on this because what I feel, the role of soft skills is even higher in healthcare industry, because we are treating with patients, attendants, where stress levels are very, very high. So the empathy, the role of empathy is very high when it comes to soft skill training in hospitals. So we do verbal skills training, non-verbal skills training, communication on effective empathizing of the patient. All these specialized modules we are running in the hospitals for our employees and making them equipped to deal with cancer patients in the best possible ways. So this every Sunday we conduct one program, and the response which we got from our employees is amazing. And this has all translated into patient satisfaction, increase in patient satisfaction. We were maintaining around 80 to 83% patient satisfaction. Right now, our patient satisfaction level is nearly 89 to 90% because of 1 year of rigorous soft skills training, which we have given 360 degrees. All the doctors in the hospitals, including consultants, have been given this training program. This tumor board system is one very unique thing in cancer care because we treat patients according to the international cancer care guidelines. And in this, a collective vision of surgical oncology, radiation oncology, medical oncology, bone marrow, they all sit together and discuss what is the best treatment path for the patient. And this collective knowledge sharing has given our patients a great edge, because of which even patients who are treated elsewhere, they are referred to us for taking opinion. We give them what would be the best treatment considering the progress of the disease, and then the treatment is done according to that, according to the international cancer treatment guidelines. So this tumor board system is quite unique to us. We do a lot of CSR work. We organize around 15 to 20 camps every month, month on month. These are totally free camps where we spread awareness about cancer, because friends, only way to cure cancer is to detect it early. And for that, creating an awareness, detecting it early, what prevents cancer. India, my friend, is a cancer capital for oral diseases. So for oral cancers, we have the maximum incidence in the world. Because of pan, gutka, smoking, all these things have made India a big hub for disease control in this area. So especially oral cancer cure, we are targeting a lot of free cancer detection camps in the hospitals, in the camps, in the RWAs. Second area is for the breast cancer. We have a special program, Be Sure, where we educate women about self-examination so that any change, any early detection of cancer can be possible. And third important cancer is cervix cancer, for which pap smears are done free of cost. So oral cancer, breast care, and cervix care, these are the three areas on which we do a lot of CSR work to detect cancer in early stages. And we have been able to improve survival rates. We have nearly 20,000 people who have survived cancer in our hospital, and that is a very big number considering 25 years we have been in operations. Now, Center of Excellences, as I told you, we have radiation oncology, radiotherapy as our Center of Excellences because of latest technology, state of equipment. Then second Center of Excellence is surgical oncology, where we do organ-specific units we have head and neck, breast, plastic, gastro, uro, neuro. So all this have a fourth level of specialization. Then chemotherapy, because reason one why we are participating in this summit, nearly 50% of cost of cancer goes into drugs. So this is the amount which, and the higher the specialization, the higher the amount of expenditure. It would be 20% for a specialty hospital, but when it comes to super specialty hospital, it can go to 70%. Like for bone marrow transplant, we have 70% of our bills which are going into only drugs and consumables. So that is the contribution from the pharma industry in patient care in improving the outcomes. So all sort of chemotherapies we are giving in the hospital. Radiotherapy, BMT, I have already told you, bone marrow transplant. Radio diagnosis, again, because you have to detect cancer early on. And the only way you can do is by having the latest machines to detect the cancer in the early stage. Then to diagnose cancer, you require a very good pathology facility where you can do tissue diagnosis. You have a full-fledged pathology lab. We have all this facility in Dharamshila Cancer Hospital. And the latest equipment, latest facility is making this possible. Full-fledged blood bank facility. The concerns of international patients generally about hygiene, safety, language, follow-up, cost, and we have a special department of international marketing in which we provide airport pick and drop facility, coordination, interpreters, assistance for room. All this is done so that patients stay, especially who are coming from outside, is comfortable. And we have relationship managers and tie up with all the leading insurance and corporate groups. To reach out directly to the potential patients, we are doing web-to-web web marketing and international promotions. We give advertisements in newspapers. And answer to we have a 24/7 contact center in which all the queries which arise from the website are answered with toll-free numbers. And so this sort of technology usage for bringing the latest, the best results, We are using, our website is one of the better websites you would find. If you go to dhrc.in, you will find a very informative website because it serves two purposes of patient education as well as making them aware. Education means what causes cancer, oral cancers, what is breast cancer. You get all the information related so that patients are able to, we are able to educate them well early on. The disease progression is not there. So PR and web is very high. As I told you, 15% is the total incidence of cancer if we consider the total medical tourism business. Now the recognition of mutual medical qualification between two countries, quality norms, better air connectivity, and organizing international medical tourism conferences, this can all help in increasing the business. One great thing has happened is starting of e-visa facility. M-Visa has been a great theme because medical visa through which, but patients still needed to go to the person, and still the stringent bureaucratic norms makes it inconvenience for a lot of patients who come from outside. They give us this feedback. Now the e-visa facility has been started and it is a great help. So we sincerely urge through this conference that this e-visa be given more importance in time to come. 40% approximately our business is dependent on drugs only. So a role of, in cancer care, chemotherapy costs are huge. So our clinical infrastructure is excellent. India on the whole I am talking, but physical infrastructure, especially roads, public transport, cleanliness, this further needs to be improved if we are looking at further increasing India's potential for medical tourism, and develop certain tourist hubs like Goa. I was just talking to someone. We have such good places, such big tourist attractions in our country. And if you focus to develop healthcare along those areas, like Goa can become one of the very, very big medical tourism hub. So strengths, of course, our doctors, low cost, technology, opportunities. There are huge opportunities because demand-supply gap is huge. Only weakness is quality, even though NABH has started and we have about 160 hospitals which are NABH recognized, but in our country we have, friends, 30,000 hospitals. So 160 hospitals is still a small figure. We have a long way to go. And threats, of course, the physical infrastructure, visa problem, these are certain areas on which we have to work further on, have an integrated approach. I would request them to play a video, a small video I have for you on our bone marrow transplant facility so that you have some idea about. Can you please start the video? Volume, please.
Bone marrow is the most amazing organ in the human body. It produces 1 million cells every second from a single mother cell or stem cell, and it keeps on doing so until the last day of our lives. What happens when one such mother cell becomes ill, either at birth or at any stage of our life? The illness can be in the form of leukemia, thalassemia, or complete failure of bone marrow, as in aplastic anemia. The heart might beat, the lungs might breathe, but survival is impossible if the bone marrow is diseased. To counter this, bone marrow from healthy people was fed to the diseased persons, and not surprisingly, it did not work. By 1960, 200 attempts were made at replacing the diseased bone marrow with a normal one, but none succeeded. But one man didn't give up hope. Tireless efforts from Professor E.D. Thomas and his co-workers created the art and science of blood and marrow stem cell transplantation. Over 1 million transplants have been done worldwide since Professor Thomas did his first transplant in 1968. But in India, the story is drastically different. 150 children in a million develop blood cancers. 20 in a million have aplastic anemia, or complete failure of the bone marrow. With 20 million carriers for thalassemia and 10,000 children being born with thalassemia major each year, it is an endless battle. Of 25,000 patients needing bone marrow transplants every year, less than 1,000 actually get them. But why? Answers lie perhaps in a lack of infrastructure and technology, of resources, and more importantly, lack of matched family donors. BMT needs a fully HLA